Hello everyone, it's another day and it's my hope that you are all fine and me too, I'm good. So today I'm glad to be here and the reason as to why I'm here today is to answer a question that was asked by one of my fans, and the question was how I can help someone who has inability to hold urine. So to start with, this is what we call urinary incontinence. And in urinary incontinence, there is loss of bladder control caused by problems in the muscles and nerves that help the bladder to hold or pass urine. And one thing you have to know is that we have different types of urinary incontinence. The first one is what we call stress urinary incontinence. And in stress, there is urine leakage associated with increased abdominal pressure, which can be due to coughing, sneezing, laughing, climbing stairs, anything that can increase abdominal pressure. That type is the one we call urge or urge urinary incontinence. And in urge, there is involuntary leakage accompanied by or immediately preceded by um, urgency. The third one is mixed urinary incontinence. And in mixed, it's just a combination of stress and urge. And the last one is what we call functional urinary incontinence. And in functional, you'll find that there is inability to hold urine due to reasons other than neurologic or lower urinary tract dysfunction. This can be due to delirium, things like psychiatric disorders, things like urinary tract infections, impaired mobility, and so on. So those are the urinary or types of urinary incontinence. And I'm sure from the types you have realized that there are so many things that can cause urinary incontinence. It can be due to pregnancy, it can be due to childbirth, that's vaginal delivery. It can be due to things like change in age, menopause, things like prostate enlargement, prostate cancer, obstructions, things like neurologic disorders like stroke, brain tumors, spinal injury, and so on. It can also be due to infections like diabetes, and so many things that can cause urinary incontinence. So now let me go straight to the point and answer the question that was asked. So my advice to this person, wherever he or she is first to avoid all risk factors. Remember, there are things that can irritate the bladder. So this person is expected to avoid things like alcohol, avoid acidic foods, avoid smoking, and this patient is also expected to maintain health weight. Avoid what we call obesity because obesity is a risk factor to urinary incontinence. Another thing that I can advise this patient, wherever he or she is to eat fiber diet or fiber food. And this will help prevent constipation. Remember, constipation is also another predisposing factor or risk factor. So this patient is advised to eat fiber foods. And the other thing I can advise this patient is to practice what we call pelvic floor exercise. This exercise will help in strengthening the muscles that help in urination. So it's very important to practice pelvic floor exercise. The other thing that I can advise this patient is what we call behavioral techniques. And in behavioral techniques, there is what we call bladder training. In bladder training, this is whereby after you have the urge to urinate, you can decide to hold for like 10 minutes, you can hold for 15 minutes, you can hold for 20 minutes before you go to urinate. Once you have the urge to urinate, try to hold for some minutes before you go to urinate, and that will help the bladder muscles to strengthen. The other behavioral technique is what we call double voiding. In double voiding is whereby once you have the urge to urinate, you can go and urinate, then stay for a short duration of time, then go and urinate again. This will help you empty the bladder completely, and this will help in preventing the leakage or urine leakage. The other one is what we call scheduling all your schedule toilet visit or schedule toilet trips. This is whereby instead of waiting for the urge to urinate, you can decide to be urinating after every 2 hours or after 3 hours or after 4 hours. So have a scheduled toilet trip. Plan on how to be urinating instead of waiting for the urge to urinate. And the last one is fluid and diet management. And in this area, we have talked about things that can irritate the bladder. So this patient is expected to avoid acidic food, avoid things like alcohol, smoking, and all that. And also, this patient is advised, or I will advise this patient to reduce fluid intake, and that will also reduce urine leakage. So those are some of the things that I can advise this patient. And one most important thing is that if this patient is under any medication because of due to any condition that may have brought this urine incontinence, it's advised that this patient should comply to medication. Ensure that this patient takes the medication to that particular condition is prescribed by the doctor. So up to this point, it's my hope that you have learned something and you are going to help that person wherever he or she is. So guys, have a blessed day and keep the questions coming. Remember, I'm here for you, and I said that my major reason for this channel is to touch other people's lives, is to save lives. So keep asking questions, and in case you feel that you have something that has to be discussed away from internet, kindly you can still let me know so that we can go inbox and discuss in depth. So guys, have a blessed day and may God bless you so much. And those of you that have not subscribed, please subscribe and help me save as many lives as possible. Have a blessed day and may the Almighty God be with you now and always.